Homeopathy is very effective in the treatment of anxiety disorders as well as various physical complaints arising from anxiety and anticipation. Anxamit is an MIT formulation recommended for the treatment of complaints associated with anxiety. It is a disease-specific combination of homeopathic drugs in 30C potency. Anxiety is a feeling of uneasiness and worry, usually generalized and unfocused as an overreaction to a situation that is only subjectively seen as menacing. It is often accompanied by muscular tension, restlessness, fatigue, inability to catch one's breath, tightness in the abdominal region, nausea, and problems in concentration. Anxiety is closely related to fear, which is a response to a real or perceived immediate threat. Anxiety involves the expectation of future threat including dread. People facing anxiety may withdraw from situations which have provoked anxiety in the past. Though anxiety is a typical human response, when excessive or persisting beyond developmentally appropriate periods it may be diagnosed as an anxiety disorder. There are multiple forms of anxiety disorder such as generalized anxiety disorder and obsessive-compulsive disorder with specific clinical definitions. Part of the definition of an anxiety disorder, which distinguishes it from everyday anxiety, is that it is persistent, typically lasting 6 months or more, although the criterion for duration is intended as a general guide with allowance for some degree of flexibility and is sometimes of shorter duration in children. Anxiety can be experienced with long, drawn-out daily symptoms that reduce quality of life, known as chronic or generalized anxiety, or it can be experienced in short spurts with sporadic, stressful panic attacks, known as acute anxiety. Symptoms of anxiety can range in number, intensity, and frequency, depending on the person. While almost everyone has experienced anxiety at some point in her life, most people do not develop long-term problems with anxiety. Anxiety may cause psychiatric and physiological symptoms. The risk of anxiety leading to depression could possibly even lead to an individual harming themselves, and suicidal thoughts and tendencies. The behavioral effects of anxiety may include withdrawal from situations which have provoked anxiety or negative feelings in the past. Other effects may include changes in sleeping patterns, changes in habits, increase or decrease in food intake, and increased motor tension such as foot tapping. The emotional effects of anxiety may include feelings of apprehension or dread, trouble in concentrating, feeling tense or jumpy, anticipating the worst, irritability, restlessness, watching and waiting for signs of danger, and feeling as if mind has gone blank. There may be nightmares, bad dreams, obsessions about sensations, a trapped-in-mind feeling, and feeling like everything is scary. It may include a vague experience and feeling of helplessness. The cognitive effects of anxiety may include thoughts about suspected dangers, such as fear of dying. One may fear that the chest pains are a deadly heart attack or that the shooting pains in your head are the result of a tumor or an aneurysm. He feels an intense fear when think of dying, or may think of it more often than normal, or can't get it out of his mind. The physiological symptoms of anxiety may include 1. Neurological, such as headache, paresthesias, fasciculations, vertigo, or presyncope. 2. Digestive, as abdominal pain, nausea, diarrhea, indigestion, dry mouth, or bolus. Stress hormones released in an anxious state have an impact on bowel function and can manifest physical symptoms that may contribute to or exacerbate IBS. 3. Respiratory, as shortness of breath or sighing breathing. 4. Cardiac, as palpitations, tachycardia, or chest pain. 5. Muscular, as fatigue, tremors, or tetany. 6. Cutaneous, as perspiration, or itchy skin. 7. Urogenital, as frequent urination, urinary urgency, dyspareunia, or impotence, chronic pelvic pain syndrome. MIT formulation Anxamit is found to be very effective in the treatment of anxiety-related problems. It is very useful in avoiding stage fright, fear of examinations and interviews etc. combined with HOMEOPAThy, it helps students to face examinations with confidence and get high marks and ranking.